This video is for educational purposes only. The information provided is intended to enhance your understanding and should not be used as a substitute for professional medical advice, diagnosis, or treatment. In this unit, we focus on three key aspects: history taking, which involves gathering comprehensive patient information, vital signs monitoring to track critical health indicators, and physical examination to assess the patient's neurological status and identify any abnormalities. History taking focuses on presenting complaint, that is why the patient was admitted. It can be due to head trauma, stroke, seizure, altered mental status, on any other neurological conditions. Next, we focus on past medical history, that is previous neurological conditions like transient ischemic attack, stroke, etc., and chronic illnesses like hypertension and/or diabetes. Medication history includes current medication, over-the-counter drugs and supplements, medications affecting the nervous system like anti-epileptics, anticoagulants. Next comes the family history, including hereditary conditions like neurodegenerative diseases or familial stroke history. Social history should include alcohol or drug use, which affects the nervous system. Next part in neurological intensive care unit examination is vital signs. Vital sign examination should include blood pressure, that is hypertension or hypertension, which can affect cerebral perfusion. Monitor heart rate and rhythm, including tachycardia, bradycardia, arrhythmias, which may influence neurological status. Next, monitor respiratory rate and pattern. Abnormal pattern can indicate brainstem dysfunction. Fever can be a sign of infection or hypothalamic damage, therefore temperature monitoring is important. Next, monitor oxygen saturation. Ensure adequate oxygenation to prevent hypoxic injury to the brain. Next part in neurological intensive care unit examination is physical examination. Check for level of consciousness by Glasgow Coma Scale. To know more about GCS, watch video on Glasgow Coma Scale. Cranial nerve examination should focus on all 12 cranial nerve examination. Evaluate muscle strength, tone, and muscle bulk in all 4 limbs. Check for asymmetry or involuntary movements. Test for sensory function, including light touch, pain, temperature, vibration, and proprioception. Assess deep tendon reflexes and check for pathological reflexes, that is Babinski sign. Check size, shape, and reactivity of pupils to light. Unequal pupils can indicate serious issues like increased intracranial pressure. To assess coordination, perform finger to nose, heel to shin, and rapid alternating movement to assess cerebellar function. Look for tremors, dysmetria, or ataxia. If the patient can ambulate, assess their gait and balance. For a final picture of the patient profile, undergo the investigation results. Look for the investigations done, which can include computed tomography scan, magnetic resonance imaging. Both helps detecting brain and skull conditions. Electroencephalography helps diagnose electrical activity in the brain. Intracranial pressure monitoring is crucial for patients with traumatic brain injury, hydrocephalus, or conditions causing brain swelling. Lumbar puncture helps diagnose infectious conditions. Positron emission tomography is performed for diagnosing tumors, neurodegenerative disease, and assessing brain function. Complete blood count can help indicate infections. Electrolyte imbalance can occur in confusion state, seizures, and muscle weakness. Arterial blood gas indicates respiratory or metabolic abnormalities. Liver and renal dysfunction affects brain function. Abnormal coagulation profile can indicate a risk for hemorrhagic stroke or intracranial bleeding. Urine analysis can detect infections. Special considerations for sedated or unconscious patients. Their examination will focus more on reflexes and spontaneous movements. And also be mindful of monitoring devices during the examination.